The most common symptoms that I see for women presenting with pelvic prolapse are usually that of bulge and pressure at the introitus. They tell me that after being on their feet for a while, they feel something protruding from the vagina, or they feel pressure at the end of the day, or squatting or exercises. The other very common symptom is related to urinary function. So we have women that present with loss of urine when they exercise or run, or they cough or sneeze. So the urinary incontinence is also a very common presentation, often in conjunction with different stages of prolapse. And the prolapse can be from the uterus itself, or it could be from the bladder, or even the rectum pushing into the bladder, into the vagina, that can give them that sensation of pressure. Those are the most common presentations. These conditions are very treatable, and of course it depends on the presentation, the primary symptoms. It depends on the patient's age, their activity levels, and after a careful assessment of all these parameters, you can devise a plan of treatment, which can consist of a vaginal approach in some cases, a limited approach for, say, just incontinence, or repair of a limited compartment, such as a bladder prolapse, or a more extensive approach for a more advanced condition like a stage 4 or more advanced uterovaginal prolapse, where we have to use meshes and provide, say, a robotic approach to elevate the descending part. Well, pelvic prolapse we find in advancing age, especially in the menopausal and beyond ages. But we can find incontinence and some elements of prolapse even in younger women. It's estimated that around 40% of women will have, throughout the course of their life, some element of prolapse. But only about 2% are going to be symptomatic, and maybe perhaps 7% will need surgery at some point.